Hey guys, welcome back to another video. And the topic of today's video is just going to answer a very specific question that you will likely have whenever you're rotating through any type of ICU rotation or when a patient's going to be on ventilatory support. And that question is, when can a patient be extubated? So in this video, we'll go ahead and get into it, and hopefully you'll be able to answer this question by the end of this video. Now, before we go into more depth on when you can extubate a patient, what you'll need to know is that a huge component of deciding if a patient can move off a ventilator is something called an SBT, which is short for spontaneous breathing trial. Okay? Now, what is a spontaneous breathing trial? Now, in this video, I'm not going to get into the specifics about an SBT because there's quite a bit involved with it. An SBT assesses the ability to breathe while receiving little to no ventilator support. Okay? So that is what an SBT generally assesses. So that brings us to the next set of questions. So we know that an SBT is important to wean a patient off a ventilator. So the next things we need to understand before we move forward is one, when is a patient ready to even take an SBT? What needs to happen to pass an SBT? And then finally, what do you do next after they have passed an SBT? So let's go ahead and get started here. So the first question is, when is a patient ready for an SBT? How do I know that I can even suggest to my attending that a patient is ready for a spontaneous breathing trial? All right, and here's a few criteria that will kind of explain when a patient is ready. Now, again, this can be a little different depending on the attending, maybe the institution, but I think in general, this is a good amount of information to start, okay? So the first thing a patient will need to demonstrate in order to qualify to even be ready for an SBT is they need to have an FiO2 that is less than or equal to 50%. You would like to have a patient on a PEEP that's less than or equal to 10. Now, I've also heard from an attending that they like to see it 8 or less. So again, maybe just depending on the institution you're at, this could be different. Also, you want to see a heart rate that is lower than 140. And then for mental status, is the patient arousable? All right, so if a patient is meeting these criteria, generally it's safe to say that they are ready to attempt a spontaneous breathing trial. So what needs to happen to pass an SBT? Again, an SBT generally takes around 30 minutes and it's performed by respiratory therapy. And what they're just gonna see is if a patient is able to breathe on their own, if they decrease ventilator support. Okay, and here's some of the criteria that a patient will need to demonstrate in order to pass. All right, so step one, you need an O2 sat greater than 88% without increasing the FiO2 over 50%. So let me say that again, O2 sat greater than 88% without an FiO2 greater than 50%. Next, you're going to want an end tidal CO2 to increase by greater than 10 millimeters. And lastly, you want to assess an RSBI. RSBI stands for Rapid Shallow Breathing Index. And to calculate it, it's the respiratory rate divided by the tidal volume. And the value that you'd like to see for a patient to pass an SBT is you want that value to be less than 105. And frankly, this makes sense. If you think about a respiratory rate, a higher respiratory rate is going to increase your RSBI because it's in the numerator. If you have a patient that is breathing really, really fast, that's maybe not a good sign that they're ready to come off the ventilator. All right, so say your patient, they were ready for an SBT, they met those criteria we previously discussed, so now they've passed their SBT, now what do you do? And one of the first things you want to do is you want to assess the risk of post-extubation laryngeal edema. And you do this with something called a cuff leak test. Now, I won't get into the weeds on this specifically. I'll make another video explaining the cuff leak test. But essentially, for a cuff leak test, you're going to deflate the balloon in the ET tube and see if air is passing around. Because if you deflate the balloon on the endotracheal tube and air is not passing around the ET tube, that's a sign that the airway is swelling or edematous and it's compressing on the ET tube. Moving forward, you want to know, can they maintain their airway? Is their mental status good? Are they following commands? Another thing you want to assess is, are they producing secretions? Right? Are they going to require suction frequently? Then you want to assess if they have a history of hypercapnia. Then also you want to assess if they have a strong cough. Now, one of the last things you can do is you want to extubate this patient to likely high flow nasal cannula. And you want to maintain that for, depends who you ask, but maybe around 24 to 48 hours. All right, guys. Well, I hope that was helpful. That was a very basic, kind of ground level explanation of what you need to see from a patient in order to assess if they're ready to be extubated, what they need to demonstrate in order to pass an SBT, and then what some of the steps you can do after they've passed that SBT to assess if you can extubate. As always, guys, if you have any more questions, feel free to leave a comment or shoot me a message. I only have 10 subscribers, so really at the end of the day, if any of you wanted to see a specific type of video, I'll be more than happy to make it covering that topic. All right. As always, like and subscribe. I'll see you guys next time.